If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you. Hey, man. How's it going?
It's going well. I'm traveling and you're back in Nashville.
I know. Last week when we talked, I thought that we were going to be together, but now you're out of town.
Yeah. I'm doing well. I don't know, a lot going on in the world, but it seems like in general, I feel good about it.
Yeah, same. I feel like this was one of the better weeks work-wise. It feels like things are starting to kind of calm down. January was just a lot, in the world, and then ice storms in Nashville and all sorts of crazy stuff. But weather's a little bit warmer. Political climate outside of Epstein seems to be, a little bit more stagnant. And, that gives us a moment to think a little bit. So. Yeah. But there's certainly a lot happening in the world. You compiled some great stories for us to run through today, so I'm eager to jump in. All right, let's dig in. Starting out with the economy, actually a good news story coming off of a brutal January when it comes to layoffs, but unemployment is actually pretty low at the moment. Huh, Vic?
Yeah, unemployment fell a little bit, and 130 jobs were created in January, which was, as you can see from the chart, if you're watching on YouTube, huge uptick from December, and I don't know, some optimism there.
Yeah, 130,000 jobs in January. Certainly, better than it's been for many months. I guess the last 5 months, 6 months, this is a real uptick. So that's very good. But, as you might have expected, the majority of those jobs are in healthcare, right? And so, I think that's good for us because we continue to feel that healthcare is a high touch, very human business. The regulations are simply not going to evolve fast enough to make a real impact in the labor market from a healthcare perspective. That friction continues to create value opportunities for our companies, especially on the heels of, the SaaS apocalypse that befell the stock market over the last week. But that concentration of only one industry really driving jobs is scary. I've been having conversations with people where they're starting to say, hey, what industries are safe? And, I certainly point to healthcare. I'm like, healthcare continues to employ people. There's a lot of friction in it. There's a lot of regulation in it. People's expectations and standards are very high. And it's, it's an industry that has a lot of money flowing through it. So I don't see it, going away very quickly. But it's one of very few industries that I think you can say that about.
Yeah, I think that's right. I mean, the tech crowd is hiring, fewer and fewer employees. In general, they're growing, so that they'll still hire some, but healthcare is really the last place where we need a lot of people, and I think it will continue that way for a long time. And it's actually, I think, important to delivering care that there's a human around. I'm maybe old-fashioned, but I think someone holding your hand and sort of helping you understand the diagnosis can really be helpful.
Oh, trust me. Listen, everything I'm going through with my parents right now, humans are the whole thing. There's no technology that's going to help us navigate our situation right now, right? So switch to the next story in the Wall Street Journal. Headline is "The big money in today's economy is going to capital, not labor." This is a really interesting analysis showing that the majority of profits are being allocated to investors, to shareholders, and not to employees. So in addition to the downward trend overall, even though we had a good January around labor participation, we also have this, flow of funds that is not going to labor as well. So two difficult trends for the labor segment. There is a chart here in this article that is just astounding, looking at the delta between, the biggest companies from 1985, you have IBM, through even 2015, which is just 10 years ago, looking at Apple and the market capitalization of those companies, from a trillion perspective. Apple had not yet hit $1 trillion then. And now in 2026, we have Nvidia, Apple, Alphabet, Microsoft, all north of 3.5 trillion. So the market capitalizations for these companies have 3x'd in a 10-year window of time. Just shocking. 4x'd in a 10-year period of time. Whereas previously, for decades, they had all sort of been, all below $1 trillion.
Yeah, that's right. And really the multiples, I mean, they have grown the revenue and earnings, but the multiple your PE ratio of how they're valued has been the huge change. And that's why I think they haven't grown number of employees as much as they don't have to. I mean, they have certainly grown employees, but that like revenue per employee is something that people are starting to talk about now in venture capital land. And I think it'll start being applied to public companies as well. And it's good as venture investors, certainly, because you can grow a bigger company with far fewer people, less cost. But we need to figure out a way to give people a salary and give them a purpose in life. And if we don't have any employees, or it's fewer and fewer every year, I just sort of the half the population gets left behind, which is not that healthy. You can go down a little bit. There's another chart about since the pandemic, sort of how corporate earnings has grown versus income rates. And it's just, as you said, it's astounding. I mean, that's only 5 years or 6 years, maybe.
Wow.
But
yeah, I mean, that is absolutely astounding. It's completely detached from wages, benefits, just unbelievable. So yeah, I mean, we it feels like we're already headed towards peak capitalism, especially in that revenue per employee number, as you said. And now with AI, like if we're not in an industry that is highly dependent on labor, it's going to pull apart even more, right?
Yeah, and so I mean, I think it's not going to stop. So this is a trend that I think is going to go on for a long time.
Yeah. I mean, unless there's like a real political blowback to it. I mean, I think that's the only thing that slows this down. But I think that's difficult because we have global competition, right? That's also at play. So whatever your domestic policies are, they have to align with the nation state's interest on a geopolitical stage, and that's the challenge for political opposition right now.
Yeah. So like even if the Democratic Socialist movement really gains steam, all those companies, NVIDIA, Alphabet, Apple, they're global companies. So we could tax them, but at some point they will, reorient abroad, and it's going to be easier for them to move than for us to figure out new tax things, I think. So, be interesting to watch.
Agree. All right, a couple of VC stories, both in the care navigation space, but taking two different approaches. So the first one, Solace Health reaches unicorn status by taking the homework out of care navigation. It's MedCity News, $130 million Series C funding round. And this is a company that really rolls up their sleeves and actually does the work, right? So the round was led by IVP, bringing overall fundraising to $211 million. Also includes Menlo Ventures, Signal Fire, Torch Capital, Inspired Capital, and River Park Ventures. But as opposed to just being a digital health solution that says, hey, here's your information, here are your options, here's your lowest cost, they're actually doing the work. They're stepping in and they're managing the navigation on your behalf. So that's a differentiated value proposition.
Yeah. And calling themselves a health advocate network, I think, is an interesting market positioning to sort of signal exactly what you're saying. Like they try to represent the patient and help them with their journey.
Yeah, and look, I think that makes a lot of sense because certainly AI is going to do a good job on this front. But the data is not well structured, and there's all sorts of gotchas, and sometimes you just got to call. Websites aren't the data sources that AI would rely on. I think are not always going to be well maintained. We talk a lot about ghost networks on this show, and so there is value in having that actual human that does that last mile checking to really help make sure you get to where you need to go. And I think it's smart to differentiate leveraging humans as opposed to purely technology here.
Yeah, I agree.
Having said that, care navigation startup Garner Health scores 118 million Series D at a $1.35 billion valuation. So another unicorn. And their play is data analytics and artificial intelligence, helping employers and employees identify high quality, cost effective healthcare providers. The stories from Fierce Healthcare. Kleiner Perkins led the Series D round with Redpoint, Maverick, Kaiser Permanente, Mercy, Plus Capital around the table. So clearly Care Navigation is attracting big checks from investors, driving billion-dollar valuations, and seems to be a really important thing for the healthcare industry to figure out, and where they're looking for innovation to be a big part of that.
Yeah, they're taking a very different approach. I mean, I would have called this a narrow network. I've been told to call it a high-performing network now, where they sort of do analytics on the network of doctors that your employer offers and then recommends, hey, these 3 have better quality scores and they're less expensive for your copay, your high deductible plan. I hope it works. I mean, there's been several companies in Nashville and around the country that have tried this. It's hard to get the people, the actual employees, to pay attention and actually behave based on those recommendations. But it makes all the sense in the world. It's just hard to translate to actual change behavior.
Yes. And cost is simply not the only factor when people think about healthcare, right?
Right. Yeah. What's interesting is a lot of the low-cost places are also high quality in healthcare. And so you can get both, but people don't think about their decisions like that. They just go for like the brand or who their friend said or something.
Yes. I mean, while people do care about quality, they associate quality with familiarity, right?
Yes,
and brand recognition, not necessarily any form of analysis. So, all right, moving into policy, we've got 2 different stories, well, maybe even 3. The first, CMS plans to roll back limits on non-standard ACA plan options. So this was something this was kind of in the weeds, but I think it's important. You know, we need to kind of continue to peel back what's going on with the Affordable Care Act. So Vic, share a little bit about this, because when I think about the Affordable Care Act in the marketplaces, I think about the gold, silver, and bronze plans, but it sounds like there's more than meets the eye here.
That's how it started, which was a long time ago now. There were only gold, silver, and bronze plans. And then some point, I think it was in the Biden administration, I'm not sure, but the most recent regulation has been for each meadow color plan you have. So if you have all 3, you would have 3. For each of those, you can then do 2. So if you had all 3, you could do 6 what's called non-standard plans. And so in those plans, you don't have to offer, for instance, you don't have to offer OB and maternity care to maybe people that are, I don't know, they're 50-year-old men and they're an individual and they don't need that coverage.
Mm-hmm.
That's not standard. So that would be an example of a plan that would have different benefits. You could price it differently. There has been concern on the Democratic side that I think is well-grounded, that broadening too much creates much smaller risk pools, and the people that really need the coverage may not be able to go to those non-standard plans.
Mm-hmm.
But anyway, it has been previously 2 non-standard plans for every one of the metals. And now that limitation has been removed. So The ACA plan providers can do any number of non-standard plans, which is quite a change. And I think we will see a proliferation of all kinds of different structures. And then they also opened up the time window only for catastrophic care.
Okay.
But I think it may be a first step towards multi-year care. But you can now offer catastrophic health care for 1 year, but also for 2 years, 4 years, up to 10 years. Kind of like you have in life insurance, where a life insurer will underwrite you, and you still have to pay every year, but your rate doesn't change. That's what they're moving to, which I think is great. One of the issues that I think is a challenge in our whole system is the time discrepancy between, like, I care about my health for the next 25 years, but my underwriter has only priced it for this 12-month period, and then they'll reprice it next year. So they don't have a lot of incentive to keep me healthy unless the return is going to be within 12 months. And a lot of healthcare you can get the ROI, but it takes maybe 3 years to see the benefit. So it's a small step towards that, but I think that could be really valuable.
Yeah, I mean, the theme here, and you can kind of pair this with the rollout of Trump RX, seems to be more robust market options, right? Better tools and more robust market options for the consumer. They do, these changes do have downstream economic impacts to the industry. for sure, clearly. But I don't think that that's anything that this administration cares about. I think they solely care about, creating much more of a true marketplace where there's competition and a lot of optionality and also price transparency.
That's right. And that could be a great driver of efficiency and better plans, more efficient markets. It also, I think, as well, would maybe expose people that are vulnerable to lose coverage. So that's the trade-off that they're trying to balance.
Yeah. All right. This was a cool story. 500 million records exchanged through TEFCA, the Federal Health IT Office boasts. TEFCA is the Trusted Exchange Framework and Common Agreement. It's basically like the macro exchange for healthcare data, run by HHS ONC. It has had 4,900% growth since January 2025, as was announced by the Department of Health and Human Services. When you read through the article here on Fierce Healthcare, you see the expected suspects. Epic, they're announcing that they have more than 1,000 hospital customers and 22,000 clinics are using the EHR. And Athena Health announced that it has more than 100,000 of its providers live on TEFCA. And so, it seems like even though it has felt like a lot of bluster and press releases without a lot of work, that some of this interoperability infrastructure is finally starting to be built out. Now, I think what's interesting is to see this announced, and as an individual with medical records, I didn't know this until this article, and I don't know how to actually leverage this, but at least that underground layer of infrastructure is being built out, and we're seeing that the records are actually being exchanged, presumably from provider to provider.
Yeah, I think that's right. I mean, it should be that the provider refers you. Maybe I see my primary care and he refers me to a orthopedic surgeon, should look at something. They should be able to just easily hit TEFCA and transfer, no matter what EHR they're on, and be able to get the records and not have to do this ridiculous fax sheet of 100 pages of stuff. Mm-hmm. And I think it is also possible for the patient to get it, but I haven't tried to do it myself. So I think it's great. I mean, there's no downside to data interoperability. We have to do lots of other things, but having the patient be able to take their own data, they don't need to delete it from the first place. I mean, they can still use that data too, but I get to take my data with me to maybe get a second opinion or go, if I move, all those things have been way harder than it needs to be. And so it's great. I think they have, one of the benefits of the Trump administration is they're not worried about leaning on people. So like making sure that Epic and Athena and everyone is on board with the same standards so that it can work across the country I think it is completely positive.
Yeah, I agree. Hard to find fault with this outcome. All right, so the 340B rebate saga continues, and it looks like the AHA has tallied a win. HHS has been blocked by the courts from their rebate pilot. That would have been pretty damaging from a cash flow timing perspective for hospitals, forcing them to engage in a rebate model as opposed to get the money up front for the 340B program. And look, this is the AHA's job, right? Like their job is right. to protect these cash flows for their members, largely the nonprofit hospitals across the country, because they have enough problems that are going to be rolling out once one big beautiful bill, provider taxes and other things start really getting implemented starting next year. So I'm actually kind of happy about this. I feel like they need a break, so they can adjust to all the other changes that are happening. I mean, it's just too much at one time. So I think this is good, even if it's not forever, if it's just a temporary blocking. But it is a win, logged for the AHA, I think.
Yeah, no question. And I agree. It's a welcome sort of reprieve for maybe a year, maybe it's 6 months, maybe it's 18 months. I think the change to 340B is coming. I mean, a lot of the things that the court found were procedural. HHS didn't give enough notice. They didn't file all the right requests for comments and things. And so and then we'll go to the next story. I don't think the HHS is going to let this go, but it's going to be delayed. And hospitals then will have a chance to prepare maybe over 12 or 18 month period.
Yeah. So the next story, as you mentioned here in the New York Times, the headline is Senate questions healthcare firm for profiting off program meant for the poor, and this is basically. Okay, we're not able to, drive the change with the pilot right away. Well, we're going to, take to the PR angle and point out that this division of Vizient called Apexis is, growing profits and making all this money. Here's a middleman, taking advantage of this program that's meant to provide, inexpensive prescription drugs for, for the underserved, in the country, but yet this company Apexis is just kind of like blowing up, right? So I agree. I think this is going to be a pretty relentless march from the GOP, on this 340B issue. I think they clearly have it in their sights, but for now, I think they're going to have to, settle for these types of PR, campaigns while, HHS configures how they're going to take this pilot to market.
Yeah, no question. I mean, for a long time, there has been, let's say, complexity in the reimbursement structure. So hospital health systems maybe didn't get paid quite enough for some aspects that they're doing. And then they had supplemental payments that they got from the government. They had 340B that created some cash. And those ways to subsidize the health system operations that I think we need in a lot of areas of the country are being taken away. I agree. It's slowly, and they won a good court case. But over the next, we still have 3 years left of Trump. I think it's going to be a sort of a constant beating of the drum. So we're going to have to figure out a way to what do we want health systems to be delivering for care, and then pay them so they can deliver the care. I think it's so if we take away the 340B and the supplemental payments, I'm in favor of that and be more transparent. But then we should pay for life flight or a burn unit or some of the things that we want to have as a society. If someone has a really bad burn, we want them to be taken care of. A lot of health systems lose a lot of money in those specialty areas. I think this will force a reckoning over time.
All right, moving into payers. Let's start with Humana. You've got 3 stories back to back here, kind of recapping what is going on with Humana. So they reported their fourth quarter results and kind of par for the course with the payers. Revenue rose, so $32.52 billion from $29.29 billion, but earnings declined, right? And I think, again, the headline number here, the MLR rose to 93.1% from 92.1% the previous year. I mean, this is just, I don't know how you can operate in a market where, your medical loss, we're not even talking about the administrative costs, but your medical costs are 93% of like your overall budget. It's astounding. There's just no margin. Of course you're losing $1 billion this year, right? Compared to a loss of $862 million the year prior. Just really, really rough. Really rough.
Yeah, that's right. And what's interesting is a lot of the payers are suffering with that. Humana's leadership team is like all in for growth, right? So we lose money in every transaction, but we're going to grow 40%, and so we'll lose more next year. Somehow that makes sense to them, but that's sort of what they had earnings this week, and they announced these results, which were difficult, but they were not cutting back. They definitely are growing more. We have a couple of stories in what ways, but
yeah, and look, their stock price held, and so there could be this view that, hey, look, there's going to be a lot of weak hands in MA. We're going to pick up where those weak hands shake out. And as AI continues to, lower the cost of operations, maybe we lower our admin costs. The next story talks about how Humana is hinting at an upcoming primary care deal. Their CenterWell platform is doing quite well, over 25% growth year over year. And, maybe we offset some of the losses with this care delivery business. And then at some point, maybe the administration political winds change and we will have actually grown in a very, unattractive time to be in the MA space. and ultimately, grown our ultimate, market position. So I think if you do think about it in a 5-year lens, this could actually be quite a strong strategy for them. But in the meantime, it is going to be mounting losses.
Yeah, that's right. And Emily has taught us, so it's not my original thinking, but the MA market is not a growth market anymore. So it's going to be a sort of a melting ice cube over the next 20 years. But I agree, Humana's a well-run company. I mean, we know people up there, they're really well run. And so they're leaning in and growing in a time that I think others are scared, and that could really pay off. Yeah. They bought the Villages, sort of primary care health. The Villages is this huge, I don't know if you've ever been there, but it's like this big retirement community in Florida, by far the largest. Their primary care center went bankrupt, and Humana bought it last year out of bankruptcy. So they got another 3,200 subscribers from that deal. So they're growing
32,000.
32,000. 32,000.
Yeah, and then the final story here on Humana caps off what we've been saying, is that they could end 2026 as the largest Medicare Advantage insurer. Is Humana and United Health neck and neck? And I think, United Health is definitely trying to rebalance their books of business and have a better outcome. They've got a very broad book of business overall, commercial, Medicaid, all sorts of, lines of business over at United Health. Humana is very focused, and with their growth strategy, they could end up being the leader in MA. Yeah.
So if that's a club you want to be in, I'm not sure that I want to be in it, but it'll be the biggest.
Yeah. Well, it's their zone of genius. I mean, Yes, their zone of genius. So they might as well lean into it. All right. Now let's do one more angle of the payer segment. Let's do sort of a rundown of how companies are adapting, let's say. We're going to cover CVS, we're going to cover Oscar, and we're going to cover Cigna. We covered Cigna in depth last week. CVS's profit and revenue climb as turmoil continues in the health insurance sector. Aetna continues to drag the organization down, but the turnaround is underway, and CVS is reporting earnings that beat analyst expectations and keep its 2026 profit guidance. So that's really strong.
Yeah, they've done a good job sort of turning the ship, selling off some pieces that weren't really core, and then managing the Aetna business, which is losing money, but I think they're managing it reasonably well. So yeah, CVS had great earnings. They're doing good. They're turning. I mean, I don't know if it's off to the races, but they definitely are like working through this reorganization.
Yeah, beating analyst expectations and keeping profit guidance, that's a step in the right direction. I mean, last year it was a meltdown.
Done that. Right.
Yeah. Exactly. Oscar posts $443 million loss in 2025, but says the company's poised for profitability this year. So here's another, insurance company that seems to be, adjusting, adapting, and setting itself up for a much more stable future.
Yeah, that's right. And they always were sort of the tech-focused, newer. I mean, they're maybe 10 years old now, but they're sort of newer compared to the other payers. And it's good to see them, again, reorganizing, kind of reconfiguring to meet this time.
Yeah, and one sub thread that at some point I'd love to bring a guest on. They talk about how their growth, their top line growth, is a reflection of growth that's happening in the ICHRA business lines as there's expansion in Arizona, Florida, New Jersey, and Texas. And, you've been saying for as long as I've been in healthcare that you believe that from an employer perspective, it's going to go more to a defined contribution as opposed to a defined benefit. And I think ICHRA is really sort of code for that, right?
Yeah, that's right. ICHRA is the legal regulatory structure that allows an employer to do that. Yeah, and it's going to keep growing, I think.
Yeah. So Cigna had a lot of great news last week, and we were hailing them for, a sub 90 MLR and the fact that they strategically sold off their government business, and they're just in commercial, and in a pretty predictable, quarterly playbook move, they've laid off 2,000 workers. So in addition to having decent MLR, being in good books of business, having a good win with getting Express Scripts on the right side of the FTC, they now on top of that have shed some of their admin costs. 2,000 workers, which is just under 3% of the company's workforce. That's meaningful. That's significant cost, and we don't actually know what segment of the overall company it is, so we don't know how had how salary heavy these folks were, but we assume that this is to set them up for a continued progressive, profitable quarterly run through the rest of 2026.
Yeah, that's right. They are sort of building on their strength, a very different market in the employer space. But I think this is a strong move. Laying off people that they've figured out a way to do their work differently just builds them, sort of that compounding of maybe more profitability over time.
Yeah, I mean, certainly good from a performance perspective. Always, layoffs continue to be difficult, and just thoughts with those folks. We're going to shift to rural health. Chartis puts out their 2026 rural health state of the state, and there's no other way to put it. It's brutal. It is totally brutal.
Yeah.
I want to read for the listeners the key findings from their analysis. More than 40% of all rural hospitals operate in the red. In the 10 states that did not expand Medicaid under the Affordable Care Act, 52% of facilities operated at a loss. More than 200 rural hospitals have closed or converted to models that exclude inpatient care since 2010. 417 rural hospitals are vulnerable to closure, including 36% of hospitals in non-expansion states. Access to care continues to decline sharply in rural communities. More than 300 hospitals have eliminated OB services. More than 300 hospitals have eliminated general surgery, and more than 450 facilities have eliminated chemotherapy. Cuts to Medicaid will negatively impact rural hospitals. Nationally, more than 10 million rural residents rely on Medicaid, and Medicaid reimbursements account for nearly 10% in net revenue for the typical rural hospital. And 89% of rural census tracts are designated as healthcare professional shortage areas for behavioral health professionals. In 13 states, 100% of rural census tracts are HPSAs. That is bleak.
Yeah, it's a bleak. The rural healthcare setting is hard. I mean, the Trump administration put out that fund. The next section they talk about how they're spending the money, and it's helpful. I mean, they're bringing technology in, they're adding things, but it's a systematic challenge that is ongoing, and the $50 billion, well, useful is not going to be enough.
No, I mean, when you put 50 billion up against everything I just said,
right,
as the key findings from this analysis, it's like it's a candle to the sun, man. It's just
I mean, I think the takeaway for me is we are going to lose services in rural America. Period. I mean,
period.
It's already happening. OB, chemotherapy, general surgery are not happening in these facilities anymore. They're turning into a urgent care and then, transfer to a bigger health system in a metro area kind of service. And maybe that's all we can do, but that's going to be much harder to get care. If you're going through chemotherapy, you have to go in pretty often, and it takes a couple hours, maybe sometimes longer. And driving a long way just makes it much harder to access care. So yeah, it's going to be really probably access will be diminished through this pain in the rural market.
Yeah. So KFF Health News, has a story. The headline is Alabama's pretty cool, in quotes, plan for robots in maternity care sparks debate. And this is kind of, you can't just look at the problem. You have to try to solve it, right? And so, Alabama has a plan to use robots to improve the care for rural pregnant women and their babies. And, it's like, of course, this is going to be just politically terrifying to people. But in lieu of all the things that we just talked about that are happening in rural health, there's simply no way you're going to solve that problem with the old model. It's just not going to happen. And by the way, you can't even tie the deterioration of rural healthcare solely to the Trump administration. This has been happening for a while.
It started a long time ago.
This has been happening for a while, right? And so in this article, you have the political football going on where Dr. Oz says the idea is pretty cool and Bernie Sanders said it is decidedly not cool, right? You know,
Right. Right.
And yeah, I mean, I get it, right? Because healthcare has been the issue that's shut the government down a couple times now so far, right? So I understand that part, but I think just thinking pragmatically, Vic, how else are rural communities going to get care if not through telemedicine, robots, and artificial intelligence? Like how else is it going to happen?
Yeah, I mean, we have a shortage of healthcare workers in these regions. I mean, it was in the stats of the Chartis finding. There aren't workers to do ultrasound delivered by a medical technician or a nurse. I forget who is qualified to do it, but there's a certification that allows you to know how to do an ultrasound. And we don't have the people to do it, and they don't do enough of it that you could even really justify having someone in all these centers. And yet when a woman needs an ultrasound, I think it's great to have them be able to get into a local facility and there's a robot there, but there's a person helping with the, like, set it up and things. It's just not the same level of training and certifications you need. I think it does not solve the whole problem, but I think I like the KFF pointing out, some signs of hope, or how can we begin to find answers through new creative ways, often using technology, but do it in a way that benefits the patient.
I mean, look, when you and I listen to podcasts and we hear Elon Musk talking about, the Optimus robots or any of that other kind of stuff, and, like, is everyone going to want an Optimus robot in their house for house cleaning purposes? I don't know. But is rural America going to need robots to deliver healthcare to the populations that are still there? Absolutely. Like,
yes.
Full stop. There's nothing that we are prepared to do at this point to address the severity of the situation that does not depend on artificial intelligence and robotics. It's just not.
Yes. And an Optimist walking around a house or a provider group is very different than what they're doing here, where, yes, it's a robot, but it's a purpose-built robot to do ultrasounds on pregnant women. It is very niche. Now, I think it's wonderful, but it's not like it's going to break out and be the next Terminator. It's very kind of purpose-driven, and I think it has a really good use.
Yeah, I'm stepping back from calling it wonderful. I'm calling it absolutely necessary. I think we spent the first part of this podcast talking about the importance of human to human connection, and I do think there's sort of a technical aspect of healthcare, and then there's like the care aspect of healthcare, right? Which is the benefit of humans taking care of other humans. And I think it's a great tragedy that we haven't been able to design a healthcare system in America that would fundamentally support people being able to give care to people in rural America as it stands today. Having said that, we are where we are. Right. We are where we are. And the fact that we have arrived at this time where technology can deliver that care, I think that is wonderful because we don't have any other options.
Yeah, I agree.
Let's talk pharma a little bit. Novo Nordisk escalates their fight against hims and hers. So this has been going on for, I don't know how long we've been talking about Novo and hims and hers. It's
the Super Bowl was last year. Last year was when they kicked off their thing.
That's right. That's right. Yeah. And so, Novo's trying to make a comeback with their pill, and, hims and hers is leveraging their distribution channels to sell the same thing. And I think Novo learned a lesson from last year and said, we can't even let these guys get out of the gate. We got to hit them with a lawsuit right away. So they hit them quickly. And I think the result is Hims is, they've canceled their plans to sell the compounded GLP-1 pill.
Yeah, I agree. Exactly. I mean, the pill, it's hard for me to imagine how it is compounding pharmacy when you create a pill that everyone's taking the same pill. It was shaky logic previously.
Yeah.
But I think you're exactly right. Novo learned, and the case is much stronger this year. So, and I think it's good. Hims back down. They're doing fine. Novo did invest in the IP to create the pill, and I think they should have a chance to benefit from that.
Yeah, I agree. We're not quite ready to have pharma invest all of the money and time and take all the risk that they do to bring something to market just to have some D2C branding company leverage all of that and compete with them from day one. That, you know what I mean? Like we're just not ready to have that type of environment. It's already scary enough in the software world. Like we need to kind of protect some of the the front end risk and capital that these companies put to bear. So I think this is a good outcome.
Yeah.
Yeah.
I mean, we want
something
Novo
hits
and
generic.
other people.
Sorry,
Right,
once
exactly.
something hits generic, okay, fine. But like right out of the gate, it's too much. It's too much.
Yeah, we want to encourage Novo and others to invest in the next thing. And if they don't have confidence that there's kind of legal structures in place to allow them to make money, why would they be foolish to do new things? They would just try to steal from others. So it doesn't, I think it's better to have some kind of IP law.
Yeah, agree. All right, so it's Anthropic time. Anthropic is clearly the AI company of this moment. I want to start with discussion about their Super Bowl ads. They rolled them out a week before the actual Super Bowl. The ads were brilliant, leveraging Dr. Dre, The Difference, which is, pretty epic song to have in your commercials.
Yeah.
And also unmistakable the message they're trying to get here. Anthropic is different from OpenAI, right? OpenAI is going to put ads into your chat conversations. That's a clear violation and creepy. And Anthropic is not going to do that, right? And I think these ads were executed extremely well, and then broadcast to over 100 million people during the Super Bowl. So they kind of started out the last 7 days or maybe the last 10 days with their Super Bowl ads. Then next, they raised another $30 billion at $380 billion valuation, the second largest venture funding deal of all time. So that's just ridiculous. And as Axios reported, their subscription surge is cutting into OpenAI's lead. Over the last year, they've gone from sub 5%, penetration in terms of share of U.S. business to now having 20% share. So, OpenAI in that same period of time went from basically 20% to like 36%. So Anthropic is continuing to sort of cut the lead down and continuing to build their brand in really valuable ways. So I'll stop there because there is another side to the story for Anthropic over the last 7 to 10 days. But Vic, what say you about all these developments?
Yeah, I mean, I'm an Anthropic fanboy, so I like Claude, I like Anthropic, and I think the ads resonated with me because they seem like they're reflecting my beliefs of the two companies that I already have. And OpenAI has, of course, responded saying, we're not doing ads that are portrayed like that. They're much safer. They're much nicer. At the end of the day, ads are ads, right? So like it is better to have an experience with no ads. And it's a different part of the market. Not everyone's going to want to pay a monthly subscription to not have ads. I think we have that in entertainment. So I'm not opposed to it, but it was a brilliant set of ads because it really did draw that distinction. And I think Anthropic is hitting on all cylinders. Let's talk about the next one next. But I think even the next part's not that negative.
I don't know about that. Anthropic is known for being, kind of the conscientious AI company, right? Dario writes these exquisite, essays about the opportunity, but also the concern of integrating AI in all aspects of society and the job losses, but also the potential new industry creation, right? It's a bit of a philosopher king, right? You know what I mean? When it comes to the AI world. And they really position themselves as, truly being thoughtful around alignment. Claude has a constitution. Claude is here to align with us, right? And I think they do a pretty solid job on disclosures, right?
Yeah.
I think they do a pretty solid job on disclosures. So I get where you were headed with this. I think if any
I find it
brand,
interesting that they're friendly, better for the people AI brand, and they also raised $30 billion yesterday. I mean, they are also very successfully as a for-profit org as well. I mean, $30 billion. I remember when the first venture fund raised $1 billion for the whole fund, because I'm an old person. But $30 billion for one company is a lot of money, and they are the kinder, gentler AI, but they're also printing money over there.
well, so that is the segue into the next two stories, right? Which is on X, February 9th, the head or one of the key people in AI safety at Anthropic resigned publicly and shared a letter around that. And he is going to go get a poetry degree. But basically, I'm paraphrasing, but we'll have a link in the show notes. So please do read this yourself. He basically said it's clear that, not just because of AI, but more broadly, the world is in peril. And, he was dedicating his time at this company to trying to make sure that the AI was aligned and was safe for humans. But from inside of Anthropic, he just simply doesn't believe that that's possible. And I think it's the pull of the corporate energy against the desire to make sure that the AI is safe, right? And so, there were then a set of disclosures, maybe even in parallel, these were released, a set of disclosures around, what Anthropic discovered as they were preparing to roll out Claude Opus 4.6. And Daisy McGregor, who is the UK policy chief at Anthropic, was at an event where she was being interviewed. She said that it was massively concerning that Anthropic's Claude AI showed in testing that it was willing to blackmail and even kill in order to avoid being shut down. And so, that's a pretty not great set of stories about the conscientious company. Now, I think it's important to say they have constantly disclosed that at the end of the day, we don't really understand what we're doing here. And not we as in Anthropic, like none of us understand what we're dealing with here. And the fact that they disclosed it and the fact that it is Anthropic's policy chief communicating this, I think that is a good thing. That transparency is good. But it does seem that Claude may not be something they have control over.
Yes, that's right. I find it better than the alternative that they are talking about this and being willing to share, but it is concerning. I think the entire AI trend line is concerning on a bunch of levels, and us humans not being able to control the model. We either have already passed that point or we are in the next 6 months going to be past that point.
Yep.
And I think we don't have the option of going back and not having AI. And so of the alternatives available right now, I think Anthropic seems to be doing the best they can given the market environments where they are. Part of that process is they have a culture and they've hired people who want to do the right thing. Now, whether they can or not is certainly up for debate. But compared to, I think Google also, I have trust that Google will try to be a good steward. Now they're also a profitable company. After that, I don't have a lot of confidence in the leadership of AI companies. Not that they're not well qualified or talented or very smart. I just don't think they are attempting to worry about these things. They're just like going fast and we'll figure this out when we get there.
Yeah.
And so of the alternatives, I think it's actually a good side that Anthropic's talking about this. And someone left to go write poetry because it's going to be a hard next 2 years, next 6 months, because this stuff, you and I are in the middle of it, and it changes daily. Where there's new tools, new combinations of tools, new ways to approach it, and it is not getting slower. It's like accelerating and getting more powerful, and I think Anthropic's being honest about that, but it is kind of scary.
Yeah, I mean, this pulls me back all the way to the Eliezer Yudkowsky Bankless episode,
Yeah,
right? And
right.
and a debate that I often see online where people and I remember having this conversation with Emily, right? People are trying to fit what is happening with artificial intelligence into the mental model of other technological, societal step change moments, right?
Right.
And they keep calling artificial intelligence a tool. And it's not clear yet if it's a tool, if it's intelligent, and questionably conscious and sentient. Right? And I think this is really at the core of what is so scary, right? Is we simply don't know. We can't even define what our own consciousness is.
Right.
You know what I mean?
Yeah, I think that's right. And I'm not as worried about defining if Claude 4.6 or GPT 5.3 or Gemini 3 are conscious. I don't know if they are or not, but as they get better and better at portraying a conscious entity, it's hard for me to know what the difference is. Like if you can put yourself out there and appear like a conscious entity with a desire to continue and fight for your own existence, which is what this woman is talking about. Whether you're conscious or you're just really acting as if you're conscious, it's kind of the same thing. What I think we need to focus on is trying to be aligned, where the AI is aligned with humans so that we both are working towards the same broad goals. And that is very difficult. But I think eventually, and I don't know if eventually is 6 months or 6 years or 60 years, but there will be other types of consciousness in the, on the earth, on here. I don't know when it's going to come, but they're already getting, some people already think that their AI is conscious. And it just depends on how you judge that or how you approach it. But I'm not sure that when the point turns matters as much as it does to try to figure out how can we stay aligned so that we have value to the AI and it has value to us. And so I don't want it to be a tool necessarily. I want it to be more like mutually aligned in some way, but that itself is pretty hard.
You just said the most important part, mutually aligned, right? I think we have talked about alignment as make sure it does what we want it to do. And if it is in fact conscious, the more we invest capital in it, the more we trade out human labor for artificial intelligence, because capitalism demands that, the more leverage it gets.
And the more dependent we are on it.
And alignment between humans is based on mutual interest, but leverage is a factor.
Yes.
In alignment. And so we may be unwittingly making alignment very, very, very difficult because of capitalism's drive to give AI more leverage because it thinks it's a tool instead of a conscious entity. Now, like, it sounds totally far out to even have this crazy conversation. Like this feels like a ridiculous thing to say, but it's the question. It's the question.
I mean, there's plenty of conflicts between humans, but we all have a shared need for a certain amount of food. We all live roughly 80 years. We all have a certain capacity to do things during the day that are limited by our time and energy. And well, that makes it possible for us to get aligned, where you and I are both trying to gather resources, feed our families, build a career. We can get together and partner and do a company. AI has different set of constraints that I'm not totally clear that I can define, but they're certainly not the same as humans. And so that makes alignment, I think, much harder.
Agree. Okay, man. That's all I can do on that topic.
With that, we'll see you next week. Hopefully the world won't end in the next 7 days.
Yeah. And I'm not going to touch AI tonight. I just can't. I can't after that. Yeah. I'll pick back up tomorrow. All right, man. Thanks for putting it all together. Enjoy the travels, and I'll see you next week.